So, phase 2 of South Africa's vaccination drive began today. Inline with those senior citizens who have been able to register for vaccinations. Nearly 500,000 South Africans were vaccinated in the first trial part of our vaccination rollout that focused on healthcare workers. Healthcare workers who have not received a jab, as you heard, they are now eligible under phase 1B of the campaign that also kicked off today. South Africa's rollout has started slowly and it's depended on the availability of the actual vaccine. The health department said by this morning the number of Pfizer doses in the country was nearly 1 million. 5 million senior citizens are targeted to be completed by the end of June. Well, in Gauteng, the Health Minister, the Premier and the Health MEC, we saw they gathering with senior citizens who were vaccinated. And we were due to speak to the Department of Health, but there is a health meeting tonight, we understand, with several of the provinces involved. So let's look at the private side of things to discuss. We're joined by Lizeth Kruger, who is the manager at Dischem Clinics. Thank you for being with us, Ms. Kruger. So I understand Dischem not involved, but gearing up to be part of the second phase.
Thank you. We actually started today with our own healthcare workers that weren't involved in the Sasonke research vaccination program. And we actually did over 60 walk-ins as well. So we did only one site that we actually active at this stage. We did almost 470 vaccinations for today.
Okay,
so I don't think.
Yeah, it's a bit of a test run, I guess, for what you're gearing up to, correct?
Yeah, so we are gearing up for 11 mass vaccination sites in the country, 5 in Gauteng, 1 Free State, 1 East London, 2 Cape Town, 2 KwaZulu-Natal, and it will probably be the same as what we have at this stage at the Midrand DC. And we are going to have hopefully capacity of 500 per day per site.
All right, and so did it go well today?
Yeah, for the first day, I don't think it was too bad. I think 470 vaccinations done, and I would say probably 40% of them were over 60s. Very grateful, very grateful.
Yeah.
So it's hard work, and it's still paper-based. And I'm just confirming now, the CEO standing next to me, Ivan Saltzman, said we can ramp it up in the next, if need be, and all the boxes are ticked and all the questions are answered to 32 mass vaccination sites throughout the country.
Well, talking about ticking boxes, I mean, one of the questions has been around the pace at which sites are being accredited by the health department. How many sites are accredited by Dis-Chem, and how has that process been working with government?
So in terms of the accreditation, because we are part of the pharmacy group and pharmacy council, we actually loaded all our sites on the master facility data list from the DOH. And luckily, we tick all the boxes in terms of the legality side of medication. We understand it. That's what we do every day. We understand cold chain. So we went through the whole accreditation, and basically all our facilities, all our pharmacies throughout South Africa has been accredited. You have to just understand that the Pfizer vaccine is a little bit, it's difficult to manage due to the fact that the cold chain is quite stringent. That you have to keep it at -20 if you want to keep it for 2 weeks. If it's between 2 and 8, it's only 5 days. So that's why we're only going to do that in the mass vaccination sites.
All right. And I mean, that is one of the complications of Pfizer. Logistically, has this been very hard for Dis-Chem? Just tell us what's involved in keeping these vaccinations cold, and how many are in Dis-Chem's possession right now?
So confirm that we run about 4,000 dosages, but if you want to keep it at for 2 weeks, you have to keep it at -20. So we had to gear up with freezers that's on a monitor, because you have to have an alarm system. So it was, and I mean, it's just the cost is a bit more, much more actually, because I mean, you have to buy fridges. Like I said, if it's the Johnson & Johnson, we'll roll it out in all our stores, but the Pfizer will only be done in the mass vaccination sites.
So that'll depend on how much Johnson & Johnson you get. Is that what you're saying?
That's correct. Yeah. So we can do it in all our stores. It's just a matter of getting the stock.
All right, and that's coming through from government and everybody's working together. Just tell us how Dis-Chem fits into this all. I mean, for many people, it'll be so convenient just to go down to their closest Dis-Chem and get a vaccination. But there's the registration. This is free for people at public hospitals. It's also free for people with medical aid. How do they get into the Dis-Chem line, as it were?
So you have to register on the EVDS, and then the DRH will, it depends on what area you stay and whatever address you put in, it will direct you to your nearest site. So if it is a Dis-Chem site, then you will be directed to the Dis-Chem site. Unfortunately, if there's no Dis-Chem site near to the address that you allocated on the EVDS, they will not direct you to Dis-Chem, they will direct you to another site. So, that's how it's going to work.
Yeah. And does the system pick up if you are a public hospital patient or a private facility patient? Is there that discrimination?
No, I won't... echo your discrimination.
Okay, you know what I mean. Two funnels looking at where you are and would usually go.
So you would obviously allocate if you've got a medical aid, but that won't at this for phase 2 for the over 60s will not discriminate or direct you to a state facility if you don't have the medical aid. It will direct you to your nearest facility.
All right, finally then, we've run out of time, but just tell me how you're going to pick up. So you're at one site now, but you're saying you have this capacity. How quickly can this all happen based on what you've got in front of you at the moment in terms of those Pfizer shots?
So from a Dis-Chem perspective, we are ready. We can ramp it up. It all depends on the stock, the availability, and what the system can hold. But from a Dis-Chem perspective, we will be ready the 24th of May, definitely.
All right, with all those sites, and good news is that they've all been accredited. She said that was Lizeth Kruger, the manager at Dischem Clinics.